Okay, we're here today at Healthy Wings Family and Psychiatric Healthcare. Can you please tell us your name and your profession?
Sure, thank you for being here. First of all, my name is Dr. Jennifer Muhammad, and I am a family and psychiatric mental health nurse practitioner, duly certified, and with a lovely doctoral degree, so I get to be called doctor.
Okay, so how does this clinic serve the public?
Oh, great question, great question. Well, we started in 2016 in family medicine, so we serve men, women, and children ages 2 through whatever. I think our oldest patient right now is 88 years old. Or years young,
Oh,
right? So, as a family nurse practitioner, I do the full gamut of primary care, whatever their needs are. Of course, I'm not urgent care, but of course, we're dealing with men and women and their chronic conditions. And as a psychiatric mental health nurse practitioner, I'm dealing with men and women's and children mental health concerns. So, in primary care, we're like the coach of a person's healthcare team. So we're responsible for knowing who all the players are, the specialists, and ordering labs and ordering radiology studies and things of that nature, and helping to coordinate and manage their overall health care.
referrals.
Referrals and everything, yeah, exactly.
So why did you decide to open a clinic rather than work at a facility?
Oh, good question. Um, personally, I just did not like how most of your clinics, it's like a cattle call. You're just a number and they're moving you along. They're spending less than 5, 10 minutes with you. In my own practice, I get to spend quality care with my patients. I get to know what really, really concerns them, and then we can come up with a treatment plan to help, figure out over the next several months how we're going to help them to hopefully return back to health, or at least put them in a better position than where they were when they started me. So I enjoy that nurturing relationships, so that's why I decided to go into my venture off into my own.
How many patients do you have?
Oh, good question. Good question. All of these are great questions. I have served well over 1,300 patients since our opening, but on average, I have about 750 that I see consistently.
So do you need any assistance?
I'm always in need of help.
And if so, what kind of help do you need?
Exactly. Good question. Um, we have just launched a really great adventure. I'm doing some virtual assistant, my office assistant. She's able to do things that can be done remotely. She helps check in patients and things of that nature, fill phone calls and faxes and things of that nature. I do need someone else in office with me that's doing a little bit more hands on with patients, an office assistant, a medical assistant, someone who can help me with some of those high in administrative tasks like billing and chasing down claims and sometimes chasing down money that's owed to us. And I'm also looking for providers. I'm looking for more family nurse practitioners as well as psychiatric mental health care nurse practitioners. I like working with the nurse practitioners. And here in Arizona, we get to be what we call independent practice. I don't have to practice under the umbrella of a medical doctor,
Oh,
which kind of helps the
yeah.
patients with their healthcare cost. So we get to do all that we are educated and trained to do to the fullest extent.
That's excellent.
Yeah.
So what are there any obstacles or limitations in this?
Always obstacles. Just the human factor can sometimes be an obstacle. Sometimes people who are not able to recognize how sick they really are in the whole scheme of things. So I do a lot of educating, helping people to understand how the body works and how some of the decisions you make, not to exercise, not to drink enough water, not to poop, not to eat the right things, how those things actually impacts the overall body. So that is a really big obstacle that I face every day. Is helping to educate our community. Insurance is always an obstacle. Sometimes just not having any insurance, that limits how much health care you can actually end up getting, you know. Some of these can be life-saving tests or treatments that you can't afford. So the expense of medicine is quite costly. What else? Being a black woman in America is a hindrance, you know. And just trying to serve our people, we are still very much distrusting of ourselves, our family, and healthcare in general. So I'm in an industry where people don't particularly want to go to the doctor. The medical community has a bad rep with the black community and the Hispanic community. So yeah, those are some of the obstacles.
So I'd like to ask, how does the Honorable Louis Farrakhan influence you in your profession?
Girl, I wouldn't be here if it wasn't for him. I would not have had the mind to do for self. I would not have had the mind to sacrifice my family, my money, my time and attention for the amount of time it has taken for me to get to this level of practice and education. I've spent 13 years in school, full time, year round, while trying to deal with parents who were sick and children who have special needs and a husband who's traveling the world, So it's been quite challenging. And he, along with the Honorable Elijah Muhammad, said, accept your own, be yourself, and do for self. So it was a no-brainer for me. We were already doing some independent business operations, and when we moved here to Arizona, I saw how much of a healthcare desert we live in, and I said to myself, if there was some mass emergency, where the black people? Where's the black healthcare people? And so Richard and I decided that he would allow me to go into medicine, and into nursing, and here we are.
Yes.
Yeah, so praise be to Allah.
So this is my last question. What's next in the future for you in the healthcare field? What do you want to do ultimately after?
You mean other than sit on the beach and watch the waves come in? No. I think that I get choked up thinking about it. I really want us to have, excuse me, I'm choking literally. I really want us to have a hospital. If the horrors of how we were mistreated during this last pandemic did not teach us how important it is to have a place we can call our own, that we can go and be managed and cared for properly, without limitations, without the racism. Some of our people went into these hospitals and they did not come back out. And we can't say for sure why, what happened, in light of the black market of organ, selling and this, that, and the other. We just don't know. I'm not trying to sound like a conspiracy theorist here. But we need our own, and we don't need it just here. We need it literally all over the country. And we need men and women whom we can trust to help guide us on a path of longevity, which right now we don't seem to have.
Yeah, that is interesting.
Yeah.
So is there really discrimination in the health field?
As a provider, I get discriminated against, just sitting at the table. This is why more of us need to be at the table. We need to be inspiring our children to go into these different fields. And it's not all about everybody needs to be a doctor. We need nurses. We need assistants. We need administrators. We need somebody who's going to sweep the floors. We need someone who knows how to draw the blood. You know, we need everything. We need the respiratory therapist. We need the radiologist. We need the surgeons. We need everything. So we should really literally be inspiring our children. They're going to be the ones to take care of us. We're the next generation that's going to be aging. We're getting, you know, the 65 and 70 where we're going to need care. And I don't know who's going to do that for me right now. You know, so that's, those are some of the big ticket items that Sister Jennifer has. And to grow my practice, bring in more providers, go more into what we call practice management, where we have other providers who are also serving the community.
Well, thank you, Dr. Jennifer
Now, I
Muhammad.
have one question.
Sure.
Okay, so why the name Healthy Wings?
Ooh.
Of course, when I came out, I thought of organic fried chicken.
Okay, right.
Okay, go on.
Well, a lot of people don't know that I had my start in nursing while at the same time as a flight attendant. So wings,
Okay.
healthy wings.
Okay.
I know everybody's thinking chicken. I know. That was what Mister said. You know, we just want to call it out of some fried chicken. This is okay. Come on, get your head out of the chicken bucket.
Okay.
Well, so it's a play on. I literally went through school while flying as a flight attendant, full time and sometimes part time. So my books, my tools and resources have literally been around the world with me. You know, whenever we had downtime, maintenance issues, or we were on an overnight, I was studying and doing my assignments. And my husband, God bless him forever and a day, he went to work. He made sure that every degree, every clinical experience, every book was paid for in advance. So when all of these degrees were received, they were paid for. So there's no student debt. So that's another thing that hinders providers. Is we make decisions about employment based on that student loan debt. I ain't got no student loan debt. So I can spend the quality time that Allah has bestowed upon me serving our people. So is that all?
So far, that's great.
Okay, sounds good.
So is there any questions or any offerings that your husband would give us in advising and supporting? Just anything? Can you give him the mic?
Oh, yeah. I'll let him speak.
Please, just say something.
Hello, everybody. My name is Richard Muhammad. I'm the husband of the great Dr. Jennifer A. Muhammad. I'm so proud of her. She has built this practice. She's allowed me to help her where I can. And I look at the look on her patients' faces, how they look coming in and how they look going out. And they all look like, boy, I woke up this morning and I'm so glad I came to see Dr. Jennifer because she has really helped me. So I just want to encourage my wife to keep doing what she's doing. Don't change up on the formula. Just keep helping as many people as you can. And instead of trying to please the people, please the God that we all serve. Okay? So that's all I have to say, because I could keep going on and on and on, because she's such a wonderful person. And I mean, to step out here and walk into a field that the establishment doesn't want them to be a part of. Okay, so they pass laws. They make all kind of stumbling blocks, but not one of them has tripped my wonderful wife, Dr. Jennifer, up. Okay, so she's unscathed. If you look at her, her knees are not bloody. Okay, she's doing a fine job, and she's remaining strong and resolute because she knows that this is the right thing to do. Thank you very much.
That's tomato.
Oh, thank you. That's my baby.
I'm happy we finished without saying anything.